For the final session of the afternoon, I'd like to welcome Evening Standard book editor Katie Law and Matthew Walker, author of Why We Sleep, who will delve into the link between sleep and mental health.
Thank you, Kate. And I'm here today with Matthew Walker. My name's Katie Law, and I'm the books editor of the Evening Standard. And I had the pleasure of meeting and interviewing Matthew 3 years ago. He is the professor of neuroscience and psychology at the University of California in Berkeley, and he spends most of his time researching sleep patterns, why we sleep, and what happens to us when we don't sleep. And for this series, we're going to talk about the very, very clear and important links between mental health and sleep. So Matthew, over to you. Can you tell us about the latest research about these two important subjects?
Yeah, well, it's lovely to be back speaking with you again. And thanks for highlighting this topic, because I think it's so front of mind for many people right now during the pandemic. Particularly in the relationship between sleep and our emotional health. Firstly, what we know is that over the past 20 years, we have not been able to discover a single psychiatric condition in which sleep is normal. And that by itself told us something profound. There is a very intimate association between your sleep health and your mental health. If that's the case, then exactly what is sleep doing? And what we firstly discovered is that there is one stage of sleep called rapid eye movement sleep, what we also think of as dream sleep. And REM sleep seems to provide a form of overnight therapy. Dream sleep is emotional first aid. And it's during dream sleep that the brain will take the difficult, painful experiences, sometimes even traumatic, that we've had during the day, and it will act almost like a nocturnal soothing balm. And it will start to take the sharp edges off those painful experiences so that when you come back the next day, they don't feel as emotional anymore. It's sort of taken the sting out of it. Sleep will actually divorce the emotion from the experience. And in that way, it's not necessarily time that heals all wounds. It's time during sleep, and particularly during dream sleep, that provides that first form of emotional convalescence. And I think it was Charlotte Bronte who had this lovely phrase. She said that a ruffled mind makes for a restless pillow. And that's exactly what we're sort of discovering with that first relationship. So in the past sort of 10 years, there was a focus on dream sleep and REM sleep, and it certainly provides those benefits. But recently we published evidence, and now with some replication too, that it's not just all about REM sleep, dream sleep. Deep sleep, which is something that we call non-rapid eye movement sleep, or non-REM sleep for short, and particularly the deeper stages of non-REM, that provides a different form of sort of mental health benefit. Specifically, deep sleep is what we've now discovered to be an anxiolytic. And what I mean by that is it will ramp down the level of anxiety. And so what we did was we looked at a study where we brought people in and we measured their level of anxiety in the evening. And then we recorded their sleep across the night. And then we measured their anxiety the next day. And we were also placing them inside of a brain scanner to look at the dynamics of their emotional brain patterns. And the first thing that we found is that sleep will actually decrease the amount of anxiety. So sleep sort of brings back down the level of anxiety to a more normative level. And the greater the amount of that deep sleep, the greater the anxiety reduction. And the reason was because deep sleep actually rewires the connection between your frontal lobe and your deep emotional brain centers that trigger anxiety. And the reason that that's important is because that frontal lobe region actually applies the brakes to the anxiety centers deep within the brain. And so you re-engage the control mechanisms. Right. Whereas if you took sleep away from people, and we sleep deprive people, the longer that you're awake, the more that anxiety escalates. And it was a linear relationship. It wasn't sort of tapering off. We didn't see any sort of leveling off even after 36 hours of no sleep. And in fact, what was striking was that all of these people started off completely healthy, no anxiety disorders. They were in a normative anxiety range. After one night of sleep, almost 50% of them reached a level of, one night of no sleep, almost 50% of them reached a level of anxiety that would be classified as being now clinical, a clinical anxiety disorder. That's how quickly a lack of sleep can shift you, and the magnitude it can shift you. And so I think these two sort of discoveries and the new discovery of deep sleep's role in anxiety fits. There's another lovely quote by an entrepreneur, E. Joseph Kosman, and he once said, "The best bridge between despair and hope is a good night of sleep."
Wow.
And that's exactly what the science is finding.
So we obviously all want to know how we can get a good night's sleep. And I think there's something almost counterintuitive, because a lot of people listening to this will be thinking, yeah, but if I'm really anxious, the problem is I can't get to sleep, and it's my anxiety that's keeping me awake. And obviously at the moment and in the past year, lockdown must have really done a lot of damage in terms of people's sleep patterns and people's anxiety patterns. So can you tell us a little bit about from your point of view, how lockdown has impacted people's mental health?
Yeah, we've now got a collection of studies that have described exactly what has happened in terms of our sleep. And sleep has really changed in 4 specific ways. The amount of sleep, the timing of our sleep, the quality of our sleep, but also our dreaming. And we can come back to sort of this link in a second. Firstly, it does actually appear that on average, people are sleeping a little bit longer. If you look at the studies right now, the average seems to be about 20 to 25 minutes. Now, how is that happening? It comes back to the second way sleep has changed, which is our timing. What we've now found is that people on average are going to bed a little bit later, but they're waking up significantly later. And so the way that on average, they're elongating that sleep is that, yes, they're going to bed a little bit later, but they're waking up significantly later and adding some more sleep. And that really comes on to this issue of what we call chronotype. Are you a morning type? Are you an evening type? Or are you somewhere in between? And by the way, you don't get to decide that. It is genetically, for the most part, hard-coded at birth. It's not your choice. It's not your fault if you're a night owl. And I think what COVID has taught us is revenge of the night owls. That finally, because people don't have to commute in the morning, maybe they don't have to get the kids up to school in the morning, there is a little bit more freedom of opportunity time at night, and particularly in the morning, that allows the night owls to finally go back to living in synchrony and harmony with their chronotype, their biological 24-hour rhythm. The question, however, comes to the third point, which is quality. Now, I said on average, people are sleeping longer. If you look at the data, however, it's not really the case. There's nuance. Some people, yes, are sleeping longer, but there's another cluster of people for whom sleep has become shorter.
Right.
And I suspect, as well we all know, some people have lost their jobs. Some people don't know if they will keep their jobs. Other people have had concerns just about their anxiety with the pandemic. So little wonder that sleep has been impacted in exactly the ways that we described because of mental health, to shorten sleep, but then the quality of sleep that people are reporting. So it's one thing to have quantity change. It's another thing to have quality change. Quality on average has gone down, that people are reporting subjectively. The last part of this is dreaming.
Yes.
People have reported that people are dreaming more, and also dreaming about the pandemic.
Yes.
Why is this? Why is this happening? I think it's for three specific reasons. The first is just simply the way that sleep is structured. When we go to sleep at night, we go through 90-minute cycles, and we have non-REM sleep and we have REM sleep, and then we repeat that cycle. However, the ratio of non-REM to REM within those 90-minute cycles changes across the night. What I mean is that in the first half of the night, we get the majority of our deep non-REM sleep. Yet as we push through to the second half of the night, we get more and more REM sleep, dream sleep. So if people are sleeping in later in the morning, they're pushing themselves more into the REM sleep rich phase of your sleep cycle. And therefore, no wonder that people are reporting dreaming more, because they're just getting more dream sleep. That's the first thing. Yeah. But I don't think that explains why people would be dreaming of COVID specifically. And I think that comes back to just what we were saying to begin with. If there is a red thread that runs through our waking life into our dreaming life, like a constant narrative, it is our emotional concerns. That's what we've learned from the literature and the studies that we've been doing. And so I don't think it's any surprise that when we have these sort of emotional triggers caused by the pandemic, and we're all struggling to figure out, what does this mean? How can I fit this into my mental lexicon and make sense of what has profoundly changed this civilization right now? No wonder you have to give to the dreaming brain this bounty of an emotional challenge and say, please, can you help me understand and decompose and take apart this emotional experience? It's REM sleep therapy that's trying to help us understand the pandemic. So those are the four different ways that, based on the data at least so far, the pandemic has changed our sleep.
That's fascinating, because actually what you're saying is that there are a few quite positive things. And it's true, you know, this idea that you could actually be a little bit more flexible in terms of sleeping in longer. But I think really a big part of the conversation is what we can do, what your absolute top tips, and one just wants to hear them again and again and again. What your top tips are for anyone listening to this. You know, they're not sleeping well. They may have trouble getting to sleep in the first instance, or waking up in the middle of the night, or, you know, disturbances. And if we can just go through in a very practical way what your top tips are for getting not just one good night's sleep, but establishing a really healthy sleeping patterns, that would be brilliant, I think.
Yeah, of course. And I'll sort of end this with a very large caveat that I think is really important too. But there are probably 5 things that people can do to try to help their sleep or optimize their sleep. The first is timing and regularity. Go to bed at the same time and wake up at the same time, no matter whether it's the weekday or the weekend. And by the way, I think, you know, when you sort of hear sort of experts say, you know, these are the 5 top tips or 5 rules for exercise, I honestly, Katie, I don't think people respond to rules. They respond to reasons, not rules. And so if you don't mind, I'll try and give some of the reasoning behind sort of the rules. I feel better about that. But so regularity is king, going to bed at the same time, as I said, and then waking up at the same time. And the reason is because deep in the center of your brain, you have a master 24-hour clock. It's called your circadian rhythm clock. And it expects regularity and thrives best under conditions of regularity. And one of the things that it controls is your sleep-wake patterns. So that's the first tip, is regularity. By the way, even if you've had a bad night of sleep, don't change anything. The best advice if you've had a bad night of sleep is really do nothing. Don't go to bed any earlier. Don't take a nap during the day, and don't wake up any later the following day. Just stay the course, and that's the best advice. Right. The second component is darkness. We are a dark, deprived society in this modern era. And the reason that we need darkness is to release a critical hormone called melatonin. And melatonin helps time the onset of our sleep in a regular fashion. So the advice here would be not just to step away from, these bright computer screens in the last hour before bed. If anything, the data is now is a little bit mixed on that. At first, we thought the blue light was harming us, our sleep, and I think that's true. I think what's more powerful about these devices is less about the blue light. It's much more that they are activating and engaging. Yeah. And that strength of activation and engagement masks our sleepiness. And so you could be there saying, look, it's now 11:30 at night. I'm working away on my computer. I don't feel tired. Well, what happens if there is a huge electrical blackout, everything goes dark, and you had no more computer to work on? I suspect that within 10 minutes, you'd say, wow, I actually am quite tired, but it was the computer masking that tiredness. But I'm drifting. So we need melatonin to release that hormone. So the advice would be, see if you can disengage from devices before bed in the last hour, but also try to dim down half of the lights in your home. And you will be surprised at how that sort of dimness becomes really quite soporific. It's quite powerful, and that's due to melatonin. The third thing is temperature. We need to drop our core brain and body temperature by about 1 degree Celsius in order to fall asleep and then stay asleep across the night. And it's the reason that you will always find it easier to fall asleep in a room that's too cold than too hot, because the cold room is taking you in the right thermal direction for good sleep. So aim for a bedroom temperature of around about 18 and a half degrees Celsius. It sounds cold. You can have a hot water bottle at the end of the bed. That's fine. Wear socks, no problem at all. But cold it must be. Yeah. The fourth tip is what I would say, walk it out. And what I mean by this is, don't lie in bed awake for long stretches of time, because otherwise your brain is quickly trained to think this thing called the bed is the place where I am wide awake. Yeah. And, I have we have patients that have come into the sleep center, and I'll often speak with them, and some people will say, it's so strange, I'm falling asleep on the settee watching telly, and then I get into bed and I'm wide awake and I don't know why. And the reason is because you've trained your brain to have this trigger that your bedroom is this place of wakefulness, and you need to break that association. So here the advice is, if after 20 minutes or so that you've been trying to fall asleep, or you've been trying to fall back to sleep, it's not working, that's fine. Don't worry, I have nights like this too. I've had serious bouts of insomnia myself. I'm not immune to that. And I just know, I'm kind to myself when I say, this is just not my night. It's okay, get up. I go to another room in the house, and in dim light, I'll just read a book. I won't eat, I won't get on my computer, I won't check email. And only when I am sleepy do I return to bed, and there is no time limit for that. Right. And that way, gradually, I start to retrain my brain that this bed is the place where I'm always asleep. Right. And so I guess a good analogy would be, you would never sit at the dinner table waiting to get hungry. So why would you lie in bed waiting to get sleepy? Yes. And the answer is that you shouldn't. Just get up and get out of bed. Yeah. The fifth point makes me very, well, based on my personality, I'm a desperately unpopular person to begin with, but this one makes me even more unpopular. Alcohol and caffeine. Right. Caffeine is a psychoactive stimulant, and it's perfectly fine to have, some tea and some coffee in the morning. That's great. In fact, if anything, there are significant health benefits to having a certain amount of caffeine. But the dose and the timing makes the poison when it comes to sleep. Try to cut yourself off from caffeinated beverages after about midday or 2 p.m. because that caffeine has a very long duration of action. And in fact, if you have a cup of coffee at 2 p.m. in the afternoon, a quarter of that caffeine is still in your brain at midnight. So in other words, if you have a cup of coffee at 2 p.m., it's the equivalent of getting into bed at midnight, and before you turn the light out, you swig a quarter of a cup of Starbucks and you hope for a good night of sleep. Right. It's probably not going to happen. The final thing is alcohol. Many people, when they're struggling with sleep and they've tried lots of different remedies, they will turn to alcohol as a sleep aid. Alcohol is anything other than a sleep aid. Alcohol is problematic for 3 reasons. First, alcohol is in a class of drugs that we call the sedatives, and sedation is not sleep. But when we have a couple of drinks in the evening and we say, gosh, I fell asleep just like that, you're mistaking sedation for sleep, and they're very different. If I were to show you the electrical signature of your sleep with alcohol versus without, it's not the same. So that's the first issue. The second is that alcohol will fragment your sleep. So you will wake up many more times throughout the night. Now, the problem is that you often don't remember those awakenings. So then the next morning you get up and you feel unrefreshed and unrestored, but you don't really remember waking up. So you don't put 2 and 2 together that it was the alcohol. The final thing about alcohol is that it blocks your dream sleep, your rapid eye movement sleep, which we know is critical for things like emotional and mental health. We also know from a recent study that REM sleep is directly proportional to your lifespan. The more and more REM sleep that you have, the longer and longer your lifespan. The less and less REM sleep you have, the shorter your lifespan. And I think it was for every 15-minute reduction in REM sleep, there was almost a 13% reduction in lifespan. I could have those numbers wrong, but we certainly know that it's a linear relationship. I think the last thing I want to note there before I come on to the caveat is regarding caffeine and alcohol. I don't want to be puritanical here. You know, I am just a sleep scientist. I'm not here to tell anyone how to live. And life is to be lived to a degree. All I want to try and do is give you the science behind sleep, so that then you are empowered with the knowledge and you can make your own choices. I really don't want to say, I don't want to be finger wagging and sort of sound puritanical. The last thing I would note, and it's the caveat, that if you are struggling from a sleep disorder, such as insomnia or sleep apnea, which is heavy snoring, none of these tips are going to help you. You know, it's the equivalent of me being an athletic coach, a performance coach. I can give you all of the tips to improve your performance, but if you've got a broken ankle, none of those tips are going to help you. I need to get you to a doctor, fix the ankle, and then we can come back to optimizing your performance. It's the same way with sleep. If you think you've got insomnia, if you think you've got heavy snoring, what's called sleep apnea, go and see your doctor. No one should suffer under the cloud of insufficient sleep.
Wow, well, that's all of it makes absolute sense, and I like the caveat, and I think it's important because I'm sure a lot of people will be worrying. One question if we have time for you to answer this, is if somebody, for example, was taking sleeping pills, prescription sleeping pills, and finding that they were in a pattern where they were not able to get to sleep unless they took the pills, what would you suggest that the way that they might break that habit?
So sleeping pills right now are really recommended for a very short-term use for significant insomnia. They're not recommended for long-term use. And people unfortunately develop a dependency. And one of the problems is that when you try to stop with those sleeping pills, not only do you go back to the bad sleep that you are having, but you have something called rebound insomnia, where your sleep is even worse. We also know that there is evidence that sleeping pills have been associated with a significantly higher risk of death, as well as cancer. And so I think the advice right now is sleeping pills, you should work with your doctor and you should try to understand if there is a short-term use case for them, and there may be, but it's not the answer in the long term. And in fact, here in America in 2016, there was a landmark recommendation from the American College of Physicians based on the concerns around sleeping pills and the evidence of rebound insomnia. They said they must no longer be the first line treatment for insomnia. Instead, it must be something called cognitive behavioral therapy for insomnia, or CBTI. It's a psychological intervention treatment. It works both on sort of your cognitions and your thoughts, and also your behaviors, cognitive behavioral therapy. It is just as effective for many people as sleeping pills in the short term. But what's great is that once you start working with your therapist or your clinician, you continue those benefits for, now looking at the data, several years. So people should seek out that treatment with their doctor. There's a company that I'm involved with that is now, it's called Shuni, SHUNI. So shuni.io, if people want to explore it. And what we're really trying to do is sort of provide that type of sleep coaching and sleep therapy using digital technology. And I think with the pandemic, we've become much more comfortable with having aspects of our medicine dispensed virtually through doctor's appointments, etc. So I think the problem with CBTI is that there are not enough people who are trained in dispensing it, yet the number of people who need it is astronomical. So there's a real sort of, demand supply mismatch. And I think we can bridge that gap using this type of technology platform. And that's what we're really trying to do. And there's others out there too as well that people can explore. But please, if you have insomnia, do explore CBTI. It's definitely the first line recommendation right now.
That's a fantastic tip. Thank you. And it's been such a pleasure to talk to you. You've given
Likewise, Kate.
So much good advice always. And it's just wonderful to hear it all. And I hope everyone who's listening will agree with me that there's just much we can do. And it's all basically free and simple advice, and there's nothing very complicated about it.
Yeah.
So,
in terms of a health insurance policy, it's probably the most freely available, most democratically available health insurance policy that you could ever wish for. And for the most part, as I said, it's largely painless, which is the nice thing too. But thank you again for having me. I'm desperate to try to reunite humanity with the sleep that I think it is unfortunately bereft of. But I can't do that by myself. I need to partner with wonderful people, and you've given me multiple times a voice to sort of communicate with the public. So thank you for what you do for sleep. I will anoint you as a sleep ambassador, and you will continue to hold that. So Katie, thank you again. Thanks for having me.
Thank you so much. Thank you.
Yeah.
Thank you.
Bye.
Bye-bye.
Okay, that concludes today's sessions. I hope we provided some useful and really practical tips to help you and your mental health and well-being. We'd just like to thank all the speakers and partners today, Movember and Shout 85258. And I do hope you'll join us here next week, where we'll explore the important role that exercise and nutrition play in maintaining your mental health. Until then, bye-bye.